leading this partnership and running an NHS Foundation Trust is a privilege, but it also brings responsibility. And what we've got today really is a reflection of the fact that all of us across West Yorkshire and Harrogate Partnership feel responsible and feel accountable for the communities and the people that we serve. And I'm delighted that we're publishing this review today and that we're committing to firm actions as a result. Too often in this debate, we sit back and admire the problem, seeking ever more data and evidence about the fact that there is a problem instead of dealing with what's squarely in front of us, that people face inequality and poorer outcomes because of where they live and often because of the colour of their skin and their background. So I'm really pleased that we're doing this. I'm absolutely delighted that Professor Dame Donna Kinnaird agreed to chair the independent review. As Councillor Swift said, it's really important to get a fresh pair of eyes to come and look at what you're doing. And I think that's a reflection of the kind of partnership that we are. Just to remind you, this is a true partnership of the NHS and local authorities, the third sector, providers, commissioners and communities. We've existed for the last 4.5 years and we exist to improve outcomes for local people. In doing that, we have to address health inequalities, we have to manage variations in care, and we have to use our resources wisely to make the biggest difference possible. As Councillor Swift described, we'd already set out to work on this agenda in ways which we thought would make a difference, by making sure that care was accessible, by making sure that we had a leadership which was reflective of our communities, by tackling health inequalities, and by focusing on some of the systemic issues that face communities around employment and the environment. Once we saw the impact being felt by communities, and once we heard how scared people were by coronavirus, then we felt that we needed to do more. It was very sobering to me to listen to some of my staff talk to me about how scared they were, to relay to me some of the noises and some of the chatter that there was in their communities about how they expected to be treated during the pandemic, and how that really wasn't a conversation that was surfacing sufficiently. So as a partnership with a plan, we thought it was really important to change the dynamic, bring people in to have a look at what we're doing and really ask, are we doing enough? What more should we be doing that we're missing? And can we come together around a firm action plan? So this morning, what we're going to do is to describe a bit of the evidence of what we've heard and what we know, a bit about what we now need to do, and some firm next steps to make sure that we're not sitting here again next year or the year after and thinking, let's talk about racial and structural inequities in our society. But what we're doing is making sure that the recommendations have started to make the difference that we want to see, and that we continue to feel responsible and accountable for that progress. Thank you very much.